Hello everyone, my name is Dr. Jill Farmer. I'm a movement disorder specialist with Global Neuroscience Institute. I may be a familiar face to some and a new face to others, so I'm using this as an opportunity to introduce myself during Parkinson's Awareness Month. Usually, every April, I host a regional meeting for patients and their families to come and learn something new about Parkinson's disease, either treatment strategies, new research, new rehab facilities, and opportunities that are available. Due to COVID, we're not able to do that this year, but since we're embracing technology, I thought this would be a good opportunity to host weekly seminars, short ones, that provide some information about Parkinson's disease during Parkinson's Awareness Month. So in the next few minutes that follow, there will be a slideshow that talks about Parkinson's disease and COVID-19. Other opportunities later in the month, I would like to talk about some new research that's emerging, as well as take the opportunity to possibly answer questions that you might have. So, without further ado, I hope you find this helpful and interesting. And please share it amongst your friends, amongst your support groups, amongst your family members, all while keeping a safe social distance. One of the important things I want you all to realize is that simply having Parkinson's disease does not increase your risk of getting infected with COVID-19. So while there are other medical conditions that may increase your risk, including conditions that affect your lungs and affect your heart and affect your immune system, Parkinson's disease does not have an implication in increasing your risk for COVID-19. That said, we do know that patients with Parkinson's disease tend to be older, and older age can increase your risk. And we do know that patients with Parkinson's disease may have swallowing difficulty and may be predisposed to aspiration pneumonias and things like that. So those secondary characteristics may increase your risk, but simply having Parkinson's does not. If you do have conditions like congestive heart failure, COPD, asthma, chronic infections of the lungs, chronic conditions that affect the circulatory system or your heart, those are conditions that may impact your risk of developing or of becoming infected with COVID-19. How do you mitigate your risks? It's by keeping away from large groups and maintaining distance in your social contacts, which is why these past few weeks of social distancing have been so incredibly important. So what can you do to reduce your risk? Stay home. As stir-crazy as everyone might be becoming at the moment, it really is still quite important to stay home. If you do need to go out for essentials, then wear a mask when you go out. When you do come in from being outside, wash your hands and practice good health hygiene. Eat well, sleep well, things like that. If you take vitamins and supplements, continue to take your vitamins and supplements. So here are some questions I've been getting about what type of masks are appropriate. And for the general public, when they go out into situations where there might be other people present, like to the grocery store or to the post office or things like that, really what you need is a barrier. You don't necessarily need the N95 respirator masks that everyone has heard so much about, or even a surgical mask if you don't have access to those. But a homemade mask made out of paper or material which acts as a barrier if you should cough or if somebody else in the vicinity of you should cough or sneeze or things like that, to prevent the droplets that come forth from your nose and your mouth from permeating the air. Those masks, if they're made from paper, should be thrown away when you come in. If they're made from materials, should go right into the washing machine to be washed for the next time you need to wear it. Here's an example of how to wash your hands. I know this seems redundant and silly, but it's important because it's not simply just washing your hands under water with a trickle and then flinging them dry over the sink without having any time or thought to the amount of soap or the amount of time used. This is a nice video that shows that if the ink is to demonstrate what soap should be, to get it everywhere and everywhere, in the crevices, over your fingertips, under the nails, so that the entire skin surface of your hand is clean. And this is important because cleaning your hands with soap is a simple and very effective way to destroy the virus. And this is why. The viruses are basically balls of DNA protected by a protein. And the things that stick the protein together are grease. And plain old soap can dissolve the grease, which does not allow the virus to continue in its form and destroys it. So if you wash your hands for 20 seconds multiple times a day, that's a very good way of practicing good health hygiene to reduce your risk of contacting COVID. So how might your Parkinson's disease be impacted by COVID-19? Like I said, you're not at risk for getting COVID, but should you get it, what will happen? And it's no different than if you were to get any other stressful situation, stressful infection on the system. And patients of mine have heard me say, you cannot separate mood and movement. So when you're under a stressful situation, whether it be circumstantial stress or whether it be the stress of an infection, your movements will likely get worse. Temporarily, but they will likely get worse. So motor and non-motor symptoms mirror each other. So what does that mean? Obviously, everyone with Parkinson's or people that know people with Parkinson's know about the slowness, the stiffness, and the tremor. But if you think about how that corresponds to the non-motor symptoms, you might have a better understanding as to why some people might be a little bit more irritable or a little bit more anxious at the moment. So if you're rigid in movement, you're also rigid in your adaptability, meaning that things don't roll off your back as easily. You don't change to new schedules or new circumstances as easily as you once did. You're more stiff in your ability to change from stimulus to stimulus or from task to task. And because of this stiffness and rigidity, you may be more irritable, and that's to be expected. But hopefully this will allow you to recognize it so that it doesn't then snowball into becoming even more irritable and even more anxious. One of the ways that your motor symptoms will be impacted is because of lack of activity and lack of routine. So if you have the ability to stick to a routine that you normally would, even if you're not going anywhere, it's extremely important. Get up, take a shower, change your clothes, brush your teeth, have breakfast, and if I were to suggest, add some exercise into that daily routine because you're home, it's extremely important for both your mood and your motor symptoms. This lack of adaptability or this feeling of not being in control of the situation can lead to increased anxiety. And anxiety and depression are part of Parkinson's disease. They are the non-motor symptoms of Parkinson's disease. And there is a chemical reason because of this. The chemical that's affected with Parkinson's is dopamine. Dopamine is the feel-good chemical of the brain, and it's the great coordinator of the brain. So when you're low in it, you no longer have the ability to coordinate your emotions as well as you would like. And that is something that can be helped with both therapies and mindfulness activities, as well as medications. So it is very important when you're discussing routine to also stay on the routine of your medications, because not only does that help with your motor symptoms, but it helps keep the non-motor symptoms in check. So how can you help yourself during this time? Pay attention to the ways to reduce risk, which we discussed earlier. Stick to your routine like we were just saying, and of course stick with your exercises. And if you're worried about your medications or if your symptoms are changing, then get in touch with your doctor via telemedicine. Almost all doctors that had an outpatient practice, like my own, have transitioned over to telemedicine, being able to speak with your doctor via the phone, being able to speak to your doctor via a video chat, or being able to speak to your doctor via the computer. So if you're unsure if your doctor is available, by all means, contact the office where you were seeing your doctor, and they will be able to direct you to either setting up a telemedicine appointment or having questions answered via phone. And here is my plug for exercise. Exercise, exercise, exercise. A lot of the rehab programs in the area and those on a national level have pivoted to offering activities virtually through the internet. So the LSVT Big and Loud program, if you go to their website, you can email them at info@lsvtglobal.com, and you might be able to join online classes and online courses. They also have some regular videos on their websites for both speech and physical therapy that you might be able to watch and view. If you've already gone through the Big and Loud program, of course, continue to do those exercises that you've done at home, making it part of your routine for a half an hour twice a day. There's also Dance for PD. You don't have to be a graceful or very coordinated person to do this. You can do it via a chair, you can do it standing up, but they have created a schedule of classes that you can join online and participate in. And then locally, Robert Wood Johnson Hamilton Hospital Rehab Services is working on offering classes and courses remotely as well. So getting in touch with them to see what they have uploaded or what they have available, even if you're not necessarily a member of their gym or a member of their rehab department, it would be something that is worth taking a look at because, like I said, that's a local resource as well. And this is the information about the telemedicine. If there is one positive that we might think comes out of this entire pandemic, it might be that medicine has caught up to technology. And the thing that was the barrier for this was not the technology, but the payers. So this expansion of telehealth waiver was huge because it took away the restriction of Medicare and Medicaid, as well as some private insurers, to allow equity in payment, which means that seeing your doctor now via a telehealth visit gets paid and reimbursed for the doctor as well as much as a in-face encounter would. So there is little restriction in being able to offer these services now to patients, with the hope and expectation that now that this barrier has been breached, we will be able to continue these services going forward to some degree. Face-to-face is always best. There is something therapeutic about laying of hands on a patient and looking your doctor in the eye and looking a patient in the eye. But it's not always practical, and there are some patients that this may be a huge benefit going forward. During the current social distancing and quarantine, this is the current way that most practices are being able to interact with their patients, and movement disorders lends itself to telemedicine very well because so much of our office visits are often conversational history gathering as well as observation, and we can easily do that through the use of video chats or an online telemedicine platform. So in my practice currently, we have been doing telemedicine in all of those ways. We've been doing it either through cell phones or we've been doing it through a computer platform. The computer platform is called Amwell, and the way that it works is an email is sent to a patient. The patient then clicks on the email. For Amwell, you'll see it says operator message, you're invited to a meeting. You click on the email and then you click the button join meeting. You'll be asked to input your name and that you are the patient, and then it comes up like a Zoom meeting or a Google chat or any of the other platforms. This one is more protective for personal information, which is why it's used. But if you've been doing those other things with your family, this is the same idea. if you're doing it via a cell phone, if you have a smartphone, whether it be an iPhone or a Samsung Android. You can download an app for my patients called AW Touchpoint, and then it will, after you open the app, it will show the American Well screen. You'll see a video that says join a call, and you'll be able to have a video chat that way. If you simply have an iPhone, you can simply FaceTime. Another way is that you can do it through another platform called Doximity, and that would mean that if you have a smartphone, but not an iPhone, so we cannot FaceTime one another because I have an iPhone, then Doximity could be used. You would get a text message at the time of your appointment. You would click that link that says text, doximity.com, and that would bring you right into a video call. So overall, it is very easy to be able to adapt to the technology. I would say that for the past 3 weeks, having conducted multiple telemedicine visits, most patients do it via their cell phone, and most patients do it via either FaceTime or the Doximity because they already have those things available to them and they don't need to download anything. This is just an example of some of the platform. There are others, but this is to give you an idea of what's available. So if you are curious if your doctors are doing this, you might give a call and ask and let them know that you've heard that some of these telemedicine platforms are available for other patients or from other providers, and you're curious to see if they might offer it as well. Because it's parity of now face-to-face as well as telemedicine, visits are scheduled and billed like regular appointments. The slight difference is when you make your appointment, instead of just being asked for the reason for the appointment and your insurance, you might also be asked what type of phone you have, if it's a landline or a cell phone, and as well as an email, so that we can utilize any of those video platforms. Copays would still be collected if you typically had to provide one. And most importantly, if you're due for an appointment with your doctor, don't put it off because of the concern for social distancing and needing to go outside. These are ways that you are able to maintain your health relationship with your doctor during the time of the pandemic. And like I said, if there are questions about changes to your symptoms, if there are questions about you're worried about running out of medications, these are things that can help put your mind at ease because you're still able to have an open line of communication. And any of my patients, if you are due for an appointment or if you have questions, please get in touch with our office at 844-464-6387. If you are a new patient, we are also able to see new patients via telemedicine as well. So if that's something that you're interested or curious about, by all means, give a call. As well as the local resources for rehab therapies, there's also general Parkinson's disease resources that are both local and national that are currently offering virtual education and assistance. The Parkinson's Foundation has launched an initiative, PD Health at Home, and they are doing daily events every week, Mindfulness Mondays, Expert Briefing Tuesdays, Wellness Wednesdays, Take Time Thursdays, and Fitness Fridays. So again, one more thing to sort of add to your day that you are able to keep on a routine and keep yourself physically and mentally occupied. The Parkinson's Alliance is a local Parkinson's resource that is extremely valuable. And again, they are helpful in disseminating information or helping you get in touch with movement disorder specialists as needed. And that is our brief little overview of Parkinson's disease in the setting of the COVID-19 pandemic. Parkinson's Awareness Month is a special month and it's very important to me, and I did not want it to get overshadowed in the light of everything that's going on. I wanted you to know that there are still resources available and that you have many things in your power to stay well and take control of the situation that you find yourself in. If I can be of any other assistance, please reach out and get in touch. And hopefully we will be hosting another of these brief webinars next week and the week after that during the month of April to bring you more information. I hope you found this helpful, and I look forward to doing this again soon. Bye-bye.